congratulate Dr. Shibu Jaran, Dr. Mansingh Pawar and their colleagues, and you all who have come together.
Printing world was actually a concept we started in the year 2014. In fact, we then built an opportunity around this technology.
Ladies and gentlemen and experts, let me take this opportunity to invite all of you to this conference, this workshop, I would say technical workshop, which is actually going to emphasize and share insights on the subject on 3D printing in medical devices and equipments. This is one industry which has actually taken a leap from time, and it's always a privilege to have senior respondents who have come together to understand and also see, to make a pathway for this technology, 3D technology in the medical device and the equipment industry. Just to give a short introduction ourselves, we are a company. I'm the founder of Trinity Media and Marketing Solutions. We are a company promoting new and upcoming technologies. 3D printing and AI, artificial intelligence, is something that we are really working in terms of promoting in the country, and every industry is a beneficiary. And 3D Graphy is a platform that we initiated in the year 2018. We started with 3D printing world as a concept in the year 2015. The larger interest was to ensure that how 3D technology can be used in aerospace, defense, automobile, engineering, tooling industry, medical, healthcare, jewelry, all of these. So the technology has a great potential in each of these sectors, and they're doing well in the country. But we thought it's also important to have a platform very, very specific to dental and medical again, then dissecting it and then going deeper with different sectors and industries who are benefiting. So we have experts here and people from the pinnacle of orthopedics and orthotics like Dr. Pata sir, Dr. P.D. Agarwal sir, Dr. Girdhar sir, representing when it comes to the hospital, in terms of how hospitals should be functioning when it comes to point of care solutions, and also the Dr. Veera Babu, who is actually a maxillofacial surgeon and also the president for Association of Oral and Maxillofacial Association of India, and Shushan Banerjee, who is actually the vice president for orthopedic implant manufacturing in the country. So it's a privilege to have all of you experts come together, and none other than which I would want to take, who is a chief guest, who is actually who will be setting our roadmap in terms of seeing how medical industry is going to shape from here, is Shri Rajiv Nath, who is the chief guest. Sir, thank you so much for your presence. I will now want you to share your thoughts on the subject and the technology, and on an overall perspective in terms of how 3D technology can benefit the medical industry going forward, sir. So over to you, sir. Thank you so much.
Thank you, Dr. John, for this taking this initiative of getting us all together on this virtual platform. One of the good things of COVID, I would say, has been such kind of opportunities. Instead of just collecting in a hotel in one city in Hyderabad or Delhi or Bangalore with limited access or limited coverage, now we have a pan-India coverage from the comfort of our homes. So that makes life easy. Medical devices in India, unfortunately, we've been import dependent. Nearly 45,000 crore rupees of medical devices were imported last year. The good news is that from 70 to 90% import dependency in most cases, in many products like disposables, the imports came down by a steep 24% last year. So the Make in India Atmanirbhar campaign, the COVID has created a big push for people to come forward, and now a lot of interest from people who were not in the medical device line. Earlier, there were around 1,500 manufacturers making medical devices. Now we got many people who are making automotive components, or in the hotel business, or in the travel and tourism business, or in the food industry, or the restaurant business, or even whether the toy or the textile business or the garment exports, who ventured into making medical devices in the last 1 year. So suddenly, more than 600 people came up in last 1 year. Even many of the non-COVID care has created a big push in this direction over here. And what you've raised over here, 3D printing, definitely is something which is very, very, I would say, uh, 10 years back, it would be something like, Star Wars kind of a thing that people would be talking in terms of imagination where 3D printing could be used. So both, whether you make a medical device or in the tooling industry as an engineering product, or from the point of view of medical care, there were the different branches of usage. So in the medical device industry, would be using it to make product development, making prototypes before we would go in for single cavity or multiple cavity mold, so that we would be able to communicate and be able to understand what the product or the concept is all about, and then pass it on to a tool maker so that he would be able to make a single cavity or a multiple cavity mold for us. And this has been allowing us to now shorten the life cycle of making these components so that they can be produced faster, and they can be changed and updated faster. Many of the designs need to go through multiple iterations before they can become a commercial quality product. Similarly, for the medical profession, the doctors over here. So for me, today will be actually a day of learning, not of speaking, where we can see that how 3D printing technology is being a game changer, and we are finding that it's going to be used not only for, like I mentioned, for making medical devices prototypes, but also for making not only surgical guides or analytical models, but now they're being used for actual implants, whether they're dental implants or for making dentures, aligners, obturators. You got various even sleep apnea devices. One very interesting area where beyond orthopedic implants, I would say, or stomach implants or cranial implants, something like even for COVID testing, when swabs are being a big shortage in India because when imports stopped last year, the first few products which were made in the country, the swab sticks were made by 3D. So before we could go in for injection molding, before we could ask the manufacturers who were making the earbuds for Johnson Johnson or for like Tulip and all, making for consumer goods the earbuds and converting those production lines to making swabs for the VTM tubes for the RT-PCR testing, the swab sticks were not available. And the initial products that were made available were actually from 3D printing. So even though it was 25 to 30 rupees a piece, because of the acute shortages and zero access, that 20 to 30 rupees was being viable. Of course, when something was available finally at 3 rupees, then of course people moved on to that. So 3D printing is of course being a game changer and changing the technology. And now it's not only about the printing part of it. So are now multiple dimensions to that, which we need to understand, and this event will provide a window of opportunity over there. So it's also about imaging in a 3D manner. It's about 3D software in terms of designing, and then using the right material. So now a host of menu of products and technologies are available. A couple of years back, Andhra MedTech Zone decided to go into this. They put up the largest 3D printing unit over there in Asia, and a huge host of machines and technologies are available. Anybody and everybody who is working in the space, I would recommend to him to visit Andhra MedTech Zone, visit this 3D printing company over there, which uses that facility of Andhra MedTech Zone campus over there, and see for yourself how various components and products are being made rapidly in real time to make prototypes or making implants. And now they have tied up with the university in Australia, I think Wollongong University, which is allowing them to now do even for biomaterials. So whether it is for tissues or for capillaries or arteries, that is the next step forward, which is already happening over there. After me, you'll be hearing from Dr. G.D. Agarwal, and he'll be introduced, of course, separately to you. But this is the interesting pathway, because where a surgeon turned into an entrepreneur is able to utilize his entrepreneurial talent to convert his ideas into innovative products for the benefit of the medical community and for the benefit of the patients. So I'm pleased to invite you all. We also have an opportunity over here in terms of entrepreneurs and the new organizations to come up. So more and more you'll find that hospitals, we need to have their own 3D printing centers, either in-house or out-house. So immediately in the neighborhood, you would be needing something which will be like a point of care kind of a center, where such kind of equipment will be made available, where patients can possibly go out there, doctors can possibly go out there, and engineers will help them to engineer the products which can be used either as a model for the surgery or to plan the surgery or as a graft or as an implant. So you also have an opportunity over here, I think, in this webinar for seeing various technologies and products as part of a virtual exhibition. So good luck with that. And once again, thank you, Dr. John, and thank you all the other colleagues over here in the panel for sparing your time on a Sunday to come forward and to take the medical device industry forward. The challenge that we face and where we need your help is on the regulatory pathways. Somebody like AMTZ has been trying to establish an animal testing house so that these implants could be tested over there and could be used for human use. And even with AMTZ being a quasi-government organization which is sponsored by Andhra government and has got more than 9 ministries of central government who have invested more than 2,000 crore rupees over there in various institutes and various institutions over there, they are still challenged to get this regularized and to have an operational animal testing house. And until this is operational, somebody like Dr. G.D. Agarwal or many of the manufacturers in the country are not able to do the animal testing and prove to the medical community and to the regulators that we have a safe product. And until we have a safe product, we can't use it for human use. So that is something that we need to work jointly to get the message across to the government. We don't have regulations. We need regulations of the reasonable kind, the right kind. We don't want to be over-regulated, but we need to take care of patient safety. Thank you. Over to you.
Thank you so much, sir, for your insights and your inputs. We will definitely look into this. In fact, we have a consortium when we have researchers and experts also in material science all come together on coming up with various solutions when it comes to bioprinting in terms of testing, when it comes to soft tissues, even hard tissues. But yeah, it's the need of the hour, and we will definitely look into this and work together in confluence going forward, sir. Thank you so much for your valuable input, sir, and it's a pleasure. And I'm sure, sir, towards the day there'll be a lot of learnings, and we will get to have a clear understanding of how the technology can be a benefit for the industry going forward across specializations, sir. Thank you so much for your time, sir. Thank you for your inputs. Now, may I invite another senior respondent, Dr. Girdhar Gyani, who has actually been in his epitome in terms of a senior leader who is retired as a secretary with the Council of Certification of India, and now the DG with the Association of Healthcare Providers of India, an association for hospitals in the country. Thank you so much for your presence, sir. And as Rajiv sir mentioned about hospitals, having point of care kind of a setup. In fact, we are also working on that kind of a model. And now that you're also the advisor, your thoughts, sir, on the subject, please, sir. Thank you.
Thank you, Dr. Shibu. I have been noticing now that I think that relentlessly you have been pursuing this subject. I'm sure, in very short period of time, it will have huge impact. And I think the leaders like Rajiv and others, even association, on behalf of association, I can always say you that you have to, of course, take lead role. We will support you fully because there is a huge potential in what you are talking and what you are saying. I think you have heard from my friend Rajiv. He spoke because he is the star today, because in this particular seminar today. He is the one man who actually has been pursuing this subject for a long time. You see, I can only tell you one thing, that we have a huge shortage of the, let us say, healthcare infrastructure that is known to us. COVID has revealed it openly. Okay. And surprisingly, I can tell you, 2018 Prime Minister saying 3,000 new hospitals should open in tier 3 towns. And he repeated it next year. To best of my knowledge, not a single hospital has opened up in tier 3 towns. What are the various reasons? One of the major reasons is that my colleagues, who wants to spend money in those tier 3 towns, they say, firstly, doctors are not available. But more importantly, they told me that the clearances take 1 year time. 37 clearances are required if they have to invest in the hospital business. So I think Rajiv also mentioned in last part of his, regulation, Either we over-regulate or we do not regulate at all. I think this is the worst part of India, Certain things are so important, Sometimes, for example, I keep telling that we worry about doctors and nurses, they should come from the respective council. But allied healthcare workforce, let me tell you, 85% of them are coming through the labor contractor. These ward boys or these other technicians, we think they are not important. In fact, they are monitoring all the patient. They are monitoring oxygen. They are monitoring our devices. And we think anybody can do the job. I think I am going to raise this point, and I'm sure all of us will do this point, that patient safety is equally affected by these people. So in our country, this is the problem. We do not regulate or over-regulate. This Andhra experiment I have been seeing, that it was such a great initiative by the then Chief Minister. But I know how much effort, how much time it has taken to come to this stage. So ease of doing business, we have been talking, but even I am very sorry to say, actually Raji have been pursuing this point very, very. He doesn't mind fighting with the government on this issue. Many associations, they do not fight, but he fights. So the question is, this ease of doing business, we have got so much potential. The people sitting right in front of me, 5 of these panelists, they themselves are so reputable, knowledgeable, committed, let me tell you. But, they don't get opportunity. They are not empowered. And our bureaucrats, I have been in government for 35 years. I have seen in and out of the government. But I think today's bureaucrats, I can definitely say, they are very overcautious. You see, if you want to do business, you have to take a bit of risk. And what you were saying, that the 15,000 crores of, the equipment have been imported. I think this is a shame on us, that a highly technological country who are leader in IT, leader in space. Now we are going to be leader in even defense. And we are struggling and we are dependent so much for the medical devices on the other countries. I think there are certain other issues, not the capability, let me tell you. I don't want to bring out those issues here, but we have got immense capability. Just given little push, we can make wonders. So I will only say that technology has improved the medical health care. Life expectancy, which was, let us say, 57 years, 30 years back, today is almost 80 years, 75 years, which has diagnostic is improved, technology is improved, and future of healthcare with this shortage of the manpower and number of beds, only technology will come to our rescue. So artificial intelligence or 3D printing are, I am sorry to say, they are future of the health. I should have been saying they were the past of our country, but I think still I'm saying they are future of our country. So I think the Shibu and your company, you must work on this issue. And as Rajiv also mentioned, I think I will try to see with the help of Rajiv and you, Shibu, that how we can make it happen, that is hospital themselves, or they create a point nearby which can be commonly utilized. I don't expect single hospital to set up this kind of facility, but many areas, for example, when I went to Jalandhar, I found 150 nursing homes in one street. So we can have that kind of facility, common facility. So we need to educate our doctors. We need to, bring to the knowledge of this, and let us not depend on government. Actually, let us not talk of this. Let us pursue in our own way, and ultimately, whatever we will doing for the well-being of the common man, well-being of the patient, and betterment of our country, self-reliant. What Prime Minister has been talking. So I think all the best. Please continue these efforts. I'm sure this will bring fruits, and all our efforts will come to a logical conclusion. Thank you very much.
Thank you, sir. Thank you for your time. It is definitely very encouraging with the kind of knowledge and experience that you come from, and then to have shared this, and it's also really encourages us. And we also know for the fact, sir, that obviously there could be challenges, but we need to come out of the challenges and need to work our own space to then grow. The government will do their bit, but we need to still find ways in terms of how we can. And we already see a motivating factor with initiatives like Dr. J.D. Agarwal, sir, who's actually taken his initiative and actually have set up a center of excellence in its own way, like Surgiware. And also Sushantji also, who is the vice president for Orthopedics Implant Manufacturing Association, also have a unique center of excellence. In fact, that also comes to a point for me to share. Recently we were talking about HA coatings, sir. For the hydroxyapatite coatings. That was also being procured from abroad, surprisingly, for a lot of people who didn't know about this. Some of the doctors probably I will not be able to name them. But I'm saying here is a time that when we got to know that there are researchers and institutions who are really working hard, which also Shashanji also mentioned that he works with a lot of IITs who do and develop these, because see the information source needs to be actually proliferated, sir. There are a lot of intellects who are really working hard in material science, but not everybody is aware of that. So when we work in conference together, there's a lot of opportunities that we can create. And HA coatings, then we could connect with them, and we found that it can be manufactured here in the institution itself, and that too being very cost efficient. So indigenously, I think we need to really work, sir. And thank you so much for your expression of insights on the subject. It is a pleasure to connect with you, sir, and also have your guidance going forward. And also Rajiv, sir, as you mentioned. I think we need to work together going forward, sir, as in one voice going forward to see that how this technology can benefit. Now, may I invite Dr. Veera Babu, who is the Association of Oral and Maxillofacial Surgeons of India, somebody who is a surgeon and who is actually an end user of this technology, and he will share his share of insights on the subject. Doctor, please, he's also the guest of honor for our event. Thank you, sir.
Good afternoon, dear colleagues, senior members, and the other specialty members. At the outset, I would like to thank Dr. Shibu for this invite. You all know I represent Association of Oral and Maxillofacial Surgeons of India. We deal with the problems associated with the face, like fracture of the facial bones, if there's an oral cancer, cleft lip and palate, and cosmetic jaw surgery. Anything in the face, any pathology, any trauma, we operate. We represent the surgical specialty of the dentistry. We do 5 years of dentistry. We do 3 years of oral and maxillofacial surgery, and also we super specialize in reconstruction. See, imagine symmetry is very important for the face. What happens is when we are reconstructing this face, even 2 or 3 millimeters offset, our patients are not very happy. So we used to be extremely careful, and on table we used to assess only clinically. But this 3D technology has made our life very easy. I can proudly say, as a medical specialty, we are one of the first to start this 3D technology. Way back in 2000, for reconstructing the jaws or the fine fracture of the orbit, they are in multiple bones. It is very difficult to reconstruct it, to bring it to the pre-trauma level. So what we do is we using this software called Materialize. Nowadays we have got so many other softwares. Way back in 2000, the company called MTAP, we used to mirror it, and we used to take a 3D printing, and we used to put all the mesh, so that which made our job very easy, because these patients otherwise will be very upset when even for 2 or 3 millimeter difference in the symmetry. So I as an association, we found that this is a very important technology. Only thing, cost was very prohibitive in the beginning. But over a year, over a period, more and more people are taking this technology in their hand. The cost is coming down. I'm so happy to see a lot of partners, a lot of industry partners, a lot of senior members from governments, the other specialty we have come together so we can take this forward in a nice way so that more people are benefited. We have around 6,000 members in our association. Almost around 900 people are coming out every year, and we will be the end users. And also, even in the dental field, for implants, guided implants, Invisaligns, aligners, for everything, this 3D technology is very useful. For our instruments, this 3D technology is useful. So I really wish this conference a success. I really thank Dr. Shibu for bringing all of us under one umbrella. I hope we all work together in the future also and make our nation a great success. Thank you.
Thank you so much, sir, for your insights. And I'm sure this is a game-changing technology for head and neck in a way, in terms of making it more precise and making it more convenient. I know some certain trauma cases, even for sarcoma, where this technology has really helped because there's sometimes a loss of tissue
Issue.
face. So getting it reconstruction done and ensuring that you get back the same kind of a face is a very it's a boon to mankind. Thank you, sir, for your insight and your expression on the subject and on the technology. Now, may I invite Dr. Patraji, who is the National Secretary for Orthotics and Prosthetics Association of India. Now, he is one of the key respondents and one of the old association and only one association in the country who have been able to channelize orthotics and prosthetics. They've been doing a lot of work in conventional space, but orthopedics, while we know that orthosis can be a great boon, orthopedics is also really working in this area, wherein, again, to do with load bearing when it comes to prosthetics, we need to have new materials to see that, how it can be more sustainable. But there is a lot of work already happening. Sir, your share of inputs and insights on the subject, and then we will, please, sir.
So, good afternoon to all, respected guests, speakers, participants, and the organizers. This is the great effort by Trinity Media, the 3D Graphy, for the continuously organizing webinars on the 3D printing technology. This is always focused on spreading awareness about the technology and help Indian professionals gain more knowledge in the subject. Orthotics and Prosthetics Association of India, that is OPAI, is the national level association working for the development of prosthetics and orthotic professionals in India since 1979. These prosthetics and orthotic professionals are engaged in design, development, and fabrication of prostheses to the amputees of lower limb and upper limb, and orthosis, that is supportive aids for persons with locomotor disabilities, geriatric population, by using latest technology. This recent development in this 3D printing technology is a boon for PO and professionals. The technology is so gradually developed and have now grown well than the state of cosmetic appearance to a functional one, and is a great sign of advancement in PO profession. In prosthetics and orthotics professionals' perspective, in conventional fabrication processes, the prosthesis and orthosis needs to be manufactured, adapted for each patient as per their body anatomy, uses, and functional needs. But every wearer has a different anatomy, uses, and functional needs. So 3D printing solutions successfully combine rapid processes, fabrication processes, freedom of design, mass customization, waste minimization, and the ability to manufacture complex structures, which is best option for the professionals and optimal comfort for the end users. Nowadays, 3D printing is used in fabrication of finger orthosis to a larger orthosis like spinal orthosis. In prosthesis, the technology is more popular in fabrication of upper limb prosthesis. However, in case of lower limb prosthesis, the material strength is a concern. Few polymer companies are exploring the better material for lower limb prosthesis, which is compatible for the 3D technology. I have nothing more to share with all of you. Many eminent speakers are here to speak on the subject. I wish the success of the today's program. Thanks to the organizer, Dr. Shibu, John, and his team for organizing such a wonderful program. Thank you all.
Thank you, sir, for your insights. And I'm sure there's a lot of development happening in prosthetics going forward with material science. Orthosis, as we all understand, there's a lot of benefits in splints and even for orthopedic braces. A lot of things actually are being provided, even for shoe soles. A lot of. So I think the prospects is there. I think with more development happening. And now may I invite Shashank Banerjee, who is the vice president and also the Vice President of Orthopedics Implant Manufacturers Association, and also the founder for Orthotech India, sharing his insights. And he's also a partner for this initiative in terms of supporting the initiative, and also seeing an opportunity to start his own center very soon, because he's been in the conventional space in machining. But Shushanji, your thought, and then we go to our expert, Dr. G.D. Agarwal sir, to also start his session on giving his keynote on his the efforts made in terms of sizably taking the technology forward. Thank you, sir.
Thank you, Dr. Shibu, for introducing me to the panel and to the members at large. First of all, I would like to say that I congratulate Shibu for creating such a platform, because 3D awareness is definitely there, but he is creating a platform where there is an interaction between scientists, the end user, the entrepreneurs, the scientists, the students, and masses at large. So this is something which should be always initiated and propagated as much as possible. So 3D printing is a great technology, and I think like Orthotech, always thought of, trying to reduce as much as possible the import substitution. We have been into manufacturing of joint replacement, and we were the first company to start the robotic plasma technology in India to give the uncemented hip replacement systems in India. So we always want that the industry, the institutes, and the government should come in, cohesively work together to create a very strong business platform for everybody. That is the only way that we can grow, and we will be able to, as Dr. Gyani and Rajiv ji already has said, that we have the capabilities. What we are lacking is the input. We have the capabilities. What we are lacking is a platform. And if we can create such platforms, then we will see that Indian medical devices industry is going to be a big thing, and it will be a force to reckon with in the international market as well. Not only in India, but in the export market as well. Because we see there's a huge potential. And regarding 3D printing, there is a lot of things can be done on 3D printing, because there's a big advantage where you can get exactly, especially I will talk about orthopedics. Whenever we are making hip replacement, we are going on a basis of understanding of keeping it 1 millimeter closer dimensions. Why? Because we don't have the exact anatomy. So if 3D printing comes into the picture, then we can have anatomical hip replacements, which will play a very important role in giving stability to the patient and the comfort to the surgeons as well. So as an entrepreneur, I want to promote this technology as much as possible and make India a gateway for international business manufacturers, so that we have the right people in place in institutes. Only thing is, entrepreneur institutes can come together and create like Dr. Shibu is already trying to create a platform where an entrepreneur, surgeon can come together and enjoy the facility. So our idea is basically, let us create a platform so that we can share our knowledge and come forward as much as possible. Thank you, Dr. Shibu. I think today it will be a great feast of knowledge between all the big, enterprising people here. Thank you very much.
Thank you so much, Shushanji, for your thoughts. And so I'm sure, as you mentioned, Rajiv sir and all the other dignitaries, this technology has a lot of opportunities in terms of what it can offer. I know for a fact that even for doctors, it was only 3 days back that I was talking to a a maxillofacial surgeon, he did mention that he's got a patent on sleep apnea. And now, sleep apnea being one of the cases for everybody. I mean, I'm sure 80-85% of them are actually suffering from snoring. As a, I mean, it's not a sickness, but everybody has that problem. But now you have a solution wherein you can scan your mouth and the anatomy, and you can print a device which is very specific to that one person. So sleep apnea, which also means that what it says is that 5 seconds a person is actually breathing less while you're sleeping, because nobody knows, when you're sleeping, you are not in control. So which means there is immense of oxygen that might be missing. You will not be taking oxygen at that point of time. So it could be regular. So I think small equipments like these and devices can be of great importance and relevance for mankind. And then to talk about complicated surgeries like craniofacial surgeries, or even going up there with hard patches with various biomaterials going forward. So thank you so much, this eminent panel who have shared their insights on the subject. It's always a pleasure to connect with you all, and we will definitely continue our initiative in terms of seeing each of these specialization needs to be addressed, and where all we can come together and work together. Raju sir, thank you so much for your presence, sir. And we would want all of you dignitaries being present, sir, at your convenience, be there for the day. I'm sure it will be a great learning. And I'm sure this conference, and we will also be sharing the insights with the records on the subject also going forward. And thank you so much for all the participants. Now we will actually talk about the technical sessions and also the platforms with each of these technologies that we will be addressing as we progress with the day. It is my privilege to introduce you to Dr. P.D. Agarwal, sir, also a surgeon by profession, an end user who's been using this technology and now having set up his own center of excellence in Shahanpur in UP. And sir, thank you so much for your time and your presence. And I'm sure there'll be a great learning from you. So we will now end this session. We'll go to the next session, which Doctor is the keynote speaker, and he will take us through his